Hi, I'm Dr. Rajveer Purohit. I'm the Director of Reconstructive Urology at Mount Sinai. My specialty is gender-affirming surgeries, particularly gender-affirming genital surgeries. So I'll do metoidoplasties, phalloplasties, as well as vaginoplasties. And we offer all types of vaginoplasties, including peritoneal flaps, penile inversions, sigmoids, as well as minimal depth vaginoplasties, as well as orchiectomies. So what is bottom surgery for trans women? And that incorporates a lot of different things, but broadly speaking, there's two types of bottom surgery that I offer. The first is an orchiectomy, where we remove the testicles. And the advantage of that is that women don't need to be on spironolactone or some of these hormones that can have side effects. And the other type of bottom surgery is a vaginoplasty, which is creating a new vagina. Are bottom surgeries covered by insurance? In New York State, the answer is yes. The state legislature has mandated coverage. Unfortunately, that's not true all across America, and in some states, the states have not mandated coverage, so it's really up to the insurance company. So what are the bottom surgery options for trans women? So one option is an orchiectomy, where the testes are removed, and the other option is some form of a vaginoplasty, where a new vagina is created. What is a vaginoplasty, and what types of vaginoplasties are available? I offer 4 different types of vaginoplasties to patients, and not just one. So one, probably the most common type of surgery I perform is a penile inversion vaginoplasty, where all of the male genitalia is removed, and we create a new vagina using skin from the scrotum to give you additional depth. The second type of vaginoplasty I offer is a robot-assisted peritoneal flap. With that surgery, it's the same as the penile inversion vaginoplasty, where the male genitalia is removed, and the outside looks the same. But on the inside, we add in a peritoneal flap, which is tissue from the inside of your abdomen that becomes sort of the cap or the top part of the vagina. The third type of vaginoplasty that we offer is using a piece of your colon, and specifically a segment of your colon called a sigmoid. We've been harvesting that sigmoid robotically, and we bring it down and it becomes a new part of the vagina. And the fourth type of vaginoplasty I offer is a minimal depth vaginoplasty. And minimal depth is a little bit different from, quote, zero depth, which some women come asking me for, because it still creates the external vulva, the clitoris, the labia minora. It's just that you don't have any depth on the vagina. So on the outside, you can't tell you had a minimal depth vaginoplasty, but there's no depth. And that type of vaginoplasty might be the right type of vaginoplasty for women who don't want to have penetrative sex and don't want to have to do some of the things they need to do to take care of the vagina. So what do you have to do before a vaginoplasty to get the surgery done? The first thing is I follow WPATH criteria, as most surgeons do, which means that you have to be on hormones for a certain amount of time prior. You have to get some letters of clearance, and there's a sort of standard workup that needs to be done. In addition to that, for patients, particularly if you're getting a penile inversion vaginoplasty, you have to have hair removed from the scrotal skin. And that's because we use that scrotal skin to create the new vagina. The hair removal is super important because if you don't do it, that hair will then grow out later on into the vagina, and that can cause problems such as infections. I've even had a patient have a stone form on top of the hair. In addition to that, I generally recommend patients stop any kind of tobacco use or any drug use beforehand, and make sure they're medically optimized. So if you have HIV or if you have diabetes, you want to make sure that all of those conditions are really well controlled and that you're as healthy as you can be before the surgery. What is a penile inversion vaginoplasty, and what are some of the common complications and risks of it? The penile inversion vaginoplasty includes taking away a lot of the penis, but leaving the nerves intact. We take away a lot of the urethra as well, and shorten the urethra substantially. We then create a new clitoris. We create labia minora, labia majora, and create depth on the vagina using scrotal skin as a graft, which means it's not attached to its own blood supply anymore. That same fact that we're using scrotal skin as a graft is one of the most common sort of complications that can result from vaginoplasty as well. And it leads to that complication because it's a graft, it tends to contract and shrink down And so women have to dilate to keep it open, essentially for the rest of their life. And if they don't dilate, they can get something called a vaginal stenosis, which is closure of that vaginal wall. There's a lot of other things that could happen. It's a big surgery. Intraoperatively, one of the things that we worry about is injury to the rectum, because we're creating a pocket between the bladder and the prostate and the rectum for where the vagina goes into. And in creating that pocket, injury can occur to the rectum. If that happens, you might need additional surgeries to get that fixed. After surgery, there's complications aside from the vaginal stenosis that can happen, including you can get an infection, you can get separation of the wound edges, even necrosis of some of the skin flaps that we do. Generally, these can be managed in a fairly straightforward fashion with just some local wound care. And sometimes patients need a little nip and tuck here to make the clitoris look a little bit better, or to give some symmetry, or to fix a fold that they're not happy with. Those are generally pretty minor surgeries that are done as an outpatient and sometimes can even be done under local anesthesia. So what are the advantages of the penile inversion vaginoplasty? The first thing is that I think we can create a really natural and normal looking vagina using this tissue that you already have. It doesn't require any incisions on the abdomen, which is different from the other types of vaginoplasties that are offered. You can have penetrative sex after the vaginoplasty, and almost all women have orgasms, are able to have sensation, like pleasurable sensations. And the surgery generally can be done safely. Women are in the hospital for about 3 days after the surgery. They're up and walking around within a day or two of surgery, eating food. So as surgeries go, although it's a big surgery, I think you have a really nice both cosmetic and functional outcome after surgery. Does the penile inversion vaginoplasty involve multiple stages? And typically the answer is no. I do everything in one stage. With one caveat that sometimes patients do require some minor revisions just for cosmetic reasons to make things look better or to make it look the way they want to look. Typically these are done as an outpatient and are minor surgeries that sometimes can even be done under local anesthesia. So what kind of recovery can you expect after penile inversion vaginoplasty, and how long will you be in the hospital? These are questions that come up pretty frequently with patients. Typically, I tell patients to expect about a 3-day stay in the hospital. After that, I generally want them to be in the New York area if they're coming from out of state for about 2 weeks in case anything comes up. But you're usually walking about 2 days after surgery. No vigorous exercise for about 6 to 8 weeks after surgery. No sex for 4 to 6 months after surgery until things have really recovered. But you'll be up and you'll be sort of being able to do work on a computer or reading books essentially the day after surgery. What I tell patients is the worst you'll ever feel is the day after surgery, and then it just gets better and better after that for most patients. And they within a week or so they're up and moving around pretty normally. One of the questions that comes up, and it's super important obviously, is one, will you be able to have penetrative sex after a vaginoplasty, and two, will you have pleasurable sensations with sex after a vaginoplasty? And the answer is yes to both of those questions, with the one exception is if you have a minimal depth vaginoplasty, no canal is formed in that situation. And so you can have penetrative sex, but there's obviously a lot of different types of sex that you can have, and you will have orgasms with the clitoris, and you still be able to have pleasure with certain types of sex. But with the other types of vaginoplasty, penile inversion, peritoneal flap, sigmoid, you'll be able to have penetrative sex, and you'll be able to have pleasurable sensations from the clitoris. A lot of women even report having pleasurable sensations from stimulation of the prostate that occurs with penetration as well. One of the interesting things, and it's never been studied, but anecdotally a lot of women have told me this, that sex is different after vaginoplasty. Prior to vaginoplasty, orgasms are often like a male orgasm, where they have a sharp peak and a pretty sharp decline afterwards. But after vaginoplasty, the orgasms tend to be more like a female orgasm, which is a longer, drawn-out orgasm, equally pleasurable, but without that sharp peak and without the sharp letdown. And so women are really happy with that. So one of the questions that women ask me all the time is, how long will my vagina be after penile inversion vaginoplasty? And typically we aim for about 6 inches, plus or minus an inch or so. It depends a little bit on the kind of genital tissue that you have available and how much scrotal skin you have available as well. And also after the surgery, it's really important to do dilations, because the dilations will keep the vagina open and prevents shortening of the vaginal length. So one of the questions that comes up is, what is a robot sigmoid vaginoplasty, and what are some of the risks associated with that? With the sigmoid vaginoplasty, we're essentially harvesting a piece of the colon, which is a part of the colon called a sigmoid, and we're using that as the new vagina. Typically, I've been using that primarily in revision operations. So if someone's already had a penile inversion vaginoplasty and developed stenosis, or they're referred because of this, then the colon is essentially a brand new vagina that can correct any kind of problems that happen with the first vagina, such as vaginal stenosis. We've also done it in a few cases as a primary operation and created a new vagina using that. The reason I have a little bit of hesitation about the sigmoid vaginoplasty is that it is an abdominal operation when we are removing a piece of your colon to create the new vagina, which means that there are some risks that don't exist with other types of vaginoplasty. Those risks include a fistula forming where the colon is put back together. You can get even an abscess forming where the colon is put back together. In addition to that, in the long run, sometimes the piece of colon that's harvested can develop inflammation that's present. The big advantage, though, to the colon vaginoplasty is that it does make lubrication, which has always been sort of the gold standard of finding a self-lubricating vagina. The downside is that even though it's a lubricating vagina that's soft and supple, sometimes it makes lubrication when you don't want the lubrication, and you have to wear a pad as a result of that, and you have to occasionally irrigate the tissue to prevent the lubrication from becoming bothersome. How long does the sigmoid vaginoplasty take? That depends a little bit on whether it's a revision sigmoid vaginoplasty or if it's a primary sigmoid vaginoplasty. If it's a primary where we have to create the vulva, the labia minora, the clitoris, then that takes about 5 or 6 hours. If it's a revision case where those things have already been done and we're just fixing vaginal stenosis, for example, then that takes about 2 to 3 hours or so. So are there multiple surgeries involved with a robot-assisted vaginoplasty? Typically, we try to fix everything in one stage. That said, sometimes patients need a little nip and tuck here that can be fixed fairly easily as outpatient surgeries. But our goal is to do a one-stage operation where the genitalia, external genitalia is created, the vaginal canal is created with a sigmoid segment, and that's it. So what kind of recovery can you expect after a sigmoid vaginoplasty? Typically it's a little bit longer than a penile inversion vaginoplasty. I usually keep patients about 3 to 4 days in the hospital as opposed to just 3 days. You'll be up and walking around though within a day after surgery. We typically start giving you food fairly quickly, even though we harvested a piece of the segment, a piece of your colon. But you'll be able to do exercise probably in about 6 to 8 weeks, but no sex for about 4 to 6 months after the surgery. So do you need to take time off of work after a robot-assisted sigmoid vaginoplasty? And the answer is yes. It's a big surgery. It's easy to forget the fact that you're having a major surgery done and you'll be in the hospital for a few days. I think the best thing is to take at least a month off of surgery so that you feel fully recovered. I don't want patients to push themselves and you have some complication because they push themselves to get back to work. I think you have the rest of your life to work and you need some time for yourself and some time to recover from this major surgery. How long will the vaginal canal be after a sigmoid vaginoplasty? Generally, the vaginal canal will be a little bit longer than it is for a penile inversion vaginoplasty. We generally aim for about 7 to 8 inches of length, and it depends a little bit on your anatomy and what kind of tissue you have. But that's our average that we've been getting for our patients. So what is a peritoneal flap vaginoplasty and what are some of the advantages and disadvantages to it? A peritoneal flap vaginoplasty on the outside looks the same as a standard penile inversion vaginoplasty. So you have the clitoris, you have the labia majora, labia minora. The big difference though is the vaginal canal, the lining of the canal, part of it is made up of peritoneum, and peritoneum is the lining of your abdomen that exists in everyone. So we use that peritoneum and we harvest it robotically and add it to the vagina, typically at the top part of the vagina on the inside. And the advantage is that it can give you some additional depth, and it can be used in patients who don't have a lot of skin on their phallus or on their scrotum. So patients who otherwise wouldn't get a lot of depth can get additional depth using the peritoneum. The peritoneum does, in my opinion, make some lubrication, particularly when it's used as a flap, which is that it's still attached to its blood supply. The problem with the lubrication is it's made in sort of the wrong spot, which is deeper in the vagina rather than at the entrance of the vagina, which is really where you want it. One of the downsides of the peritoneum is that you still have to dilate just like you would with a penile inversion vaginoplasty. And we do use robotic instruments that go inside the abdomen to harvest the peritoneum, so there's always a small risk of having some complication from that robotic portion of the surgery. So what is dilation, and how often do you have to dilate after vaginoplasty? Dilation is inserting a silicone rod that basically into the vagina to keep it open and to stretch it out. If you don't dilate, the vagina tends to close down and scar up. One of the nice things, though, is that oftentimes once you've recovered from surgery fully and healed, then you can use sex, penetrative sex, as an alternative to using the silicone rods to dilate, or as a supplement or augment to the rods. Typically, you do have to dilate for a penile inversion vaginoplasty and with a peritoneal flap vaginoplasty. For the sigmoids, you also do have to dilate, but probably less aggressively, and oftentimes you can just dilate with your finger just to keep things open. And obviously with a minimal depth vaginoplasty where there's no depth to the vagina at all, there's no need to dilate. And that's one of the big advantages to the minimal depth vaginoplasty. So how long does a peritoneal flap vaginoplasty take, and is it typically a staged operation? Typically the operation takes us anywhere from 4 to 6 hours to do, and typically we do everything in one stage. So you have the external genitalia created, and we also create the vaginal canal using the peritoneum, all in one stage. So what kind of recovery can you expect after a peritoneal flap vaginoplasty? Typically you'll be in the hospital for about 3 days after the surgery. You'll be up and walking around within a day or so after the surgery. To get your energy level back, to be able to do the things you were doing at home, typically takes about 2 weeks, a week or two, but you can exercise for about 6 weeks after the surgery, and no sex for 4 to 6 months after the surgery. So how long will your vaginal canal be after peritoneal flap vaginoplasty? Typically we aim for about 6 to 8 inches, and I'd say the average is between 6 to 7 inches after the surgery. So what is a minimal depth vaginoplasty, and what are some of the advantages and complications of this? First off, I'd like to say that I rarely offer a, quote, zero depth vaginoplasty, which some women come in asking for. And the reason I don't offer zero depth, where there's no depth at all, is I think it alters the external appearance of the vagina. So it's difficult to get the same definition of the labia majora, the labia minora, as well as the appearance of the external vagina with a truly zero depth vaginoplasty. So when someone comes in asking me for zero depth, I think what they really mean is minimal depth. And with minimal depth, we're just giving you an inch or two of depth, but that inch or two of depth that you get allows for formation of the labia majora, labia minora, the clitoris and everything, and makes it look much more natural on the outside. On the inside, though, the big difference with minimal depth vaginoplasty from any of the other types of vaginoplasties is that there's no depth on the vaginal canal, which means that you don't have to dilate, and you potentially don't even need the hair removal prior to surgery, so the surgery can be done much more quickly. The downside of the minimal depth vaginoplasty is that you can't have penetrative sex with the vagina. There's obviously other forms of sex you can have, and you can still use the rectum, but you're sort of committing yourself to not having that type of sex essentially for the rest of your life afterwards. And so you have to be pretty confident that that's not important to you. So how long does a minimal depth vaginoplasty take, and is it staged? Typically it's a much faster operation than the other types of vaginoplasties. We can often do it in about 3 or 4 hours. You'll be in the hospital potentially a day shorter than the other types of vaginoplasties, so patients can often go home on day 2, sometimes day 3 afterwards. And the recovery is a bit easier, particularly because you won't need to dilate. You'll be up and walking around a little sooner after the surgery. Will you be able to have sex after minimal depth vaginoplasty? that depends a little bit on how you define sex. You'll be able to have different types of sex, but what you won't be able to have is penetrative sex after minimal depth vaginoplasty with the vagina. So obviously you can have penetrative sex with the rectum, with the mouth, and there's other types of stimulation. You'll be able to have orgasms because a clitoris will be created, and there's ways to stimulate the prostate, which will still be present after minimal depth vaginoplasty, that can be pleasurable as well. So one of the questions that women ask me all the time is, what's the right type of vaginoplasty for me, and which one should I get done? And a lot of it depends on what's important to you, and what kind of recovery you want, and what kind of complications you're willing to accept, or risk of complications you're willing to accept. So remember, broadly speaking, I offer 4 types of vaginoplasties. One is the penile inversion vaginoplasty. The second is a robot-assisted peritoneal flap. The third is a robot-assisted sigmoid, and the fourth is a minimal depth vaginoplasty. To me, the sigmoid vaginoplasty is the one that probably has a higher risk of more significant complications, such as fistulas, problems with your bowels. And so for younger patients who are doing it as a primary surgery, I tend to sort of not encourage that option because they have to have sort of a good reason that they're going to have some of those risks. The advantage, of course, is it does provide lubrication. The second thing to think about when you decide between all of this is penetrative sex important to you or not? And if it's important to you, then a minimal depth vaginoplasty is probably not the right surgery for you, especially if you want penetrative vaginal sex. The third thing to think about is a recovery. How important is it that, one, you get the surgery done as soon as you can get it done without a lot of the pre-op hair removal, and also that you're up and walking around recovering as fast as you can be. And with minimal depth vaginoplasty, that's clearly the quickest recovery for patients. And the third thing to think about is, what is sort of the cosmetic appearance of the vagina, and what will give me the most options in life to have, penetrative sex, to have good sensation, good cosmetic outcomes. And I think with that, the peritoneal flap or the penile inversion vaginoplasty are basically very good sort of outcome surgeries. I think they're sort of the standard surgeries that we offer for patients who are considering their the first vaginoplasty or the primary vaginoplasty and don't need any revisions or anything else done. So I think they're great options to give you vaginal depth, excellent cosmetic appearance. The downside of the standard penile inversion vaginoplasty is that it does require dilations and there's no lubrication that's made with it. So you'll have to lubricate anytime you have sex, anytime you dilate. There is some lubrication with a sigmoid, and there is some lubrication with a peritoneal flap. Although, as I mentioned earlier, with the peritoneal flap, that lubrication may be in the wrong spot.